Good evening, everyone. My name is Henry Druchel, and I'm a member of the Maryland Defenders Union and AFSCME Maryland Council 3. I want to welcome everyone to tonight's forum. OPD workers, judiciary staffers, civil attorneys from Maryland Legal Aid and other organizations, defendants, litigants, members of the press, and everyone else with a vested interest in the courts reopening safely. The MDU is thrilled to be hosting this forum on strategies to protect ourselves, our clients, and our communities in the lead up to the courts reopening on October 5th. COVID-19 has thrown almost everything in our lives into chaos, and the court system is no exception. After declaring an emergency and shutting down in March, the Maryland judiciary issued a reopening plan in June that set October 5th as the date on which full operations would resume. But as June and July and August passed, the judiciary gave almost no guidance to stakeholders, attorneys, litigants, court workers, about what that reopening would look like and how it would be kept safe. It's only been in the last few weeks of September the plans have started to take shape, and even then only on a courthouse by courthouse basis and without being made publicly available in writing. It feels like the judiciary is making this up as it goes along and putting all of us at risk as a result. But while I know the members of the judiciary aren't experts in disease, transmission, and workplace safety, I'm also not an expert. I have lots of questions about the judiciary's reopening plan, but not much confidence in my own answers. And I'm guessing that every person watching is in that same position, concerned about the judiciary's approach to reopening, but not equipped to address those worries. And that's why the Maryland Defenders Union decided to put on this forum. We formed our union earlier this year to fight for the health, safety, and well-being of our clients and ourselves. In the time of COVID-19, that means calling on experts to help us understand what the judiciary is doing right, where it's falling short, and what can be done to make sure that everyone who has to set foot in a courthouse after October 5th will be as safe as possible. In a few minutes, I'll introduce our two experts, Eunice Salcedo and Peter Dooley, and we'll hear from them. But first, we wanted to hear from a variety of courthouse stakeholders about the specific challenges that they've faced over the last several months and what worries them about the planned October 5th reopening. We also want to hear from you. Whether you're watching on Zoom or on Facebook, post your questions and your concerns in the chat. Members of the MDU will be monitoring both of those, and later on tonight, we'll be talking with Peter and Eunice about those questions and concerns. But for now, let's hear from people about the current state of the courts.
The court system really needs to consider the safety and well-being of the lawyers, the bailiffs, the staff, the people who actually work in those spaces. Because to be quite honest with you, without public defenders, most of the people who we represent and speak for and that send us letters and that call us and have phone calls, most of those people cannot afford an attorney. So we are supporting the efforts of AFSCME. We are supporting the efforts of everybody having PPE and safe social distancing. A plan needs to be put in place so everybody can feel like I'm going back to my family safe. I'm not taking anything home to my family. So that the individuals who find themselves in person, court, or wherever they find themselves, that they are not subjected to being sick or catching COVID themselves. And people don't need to die unnecessarily. We can stop the spread of COVID. Folks who are succumbing to this disease and losing their lives, it really is unnecessary. We have to do more. The court system have to do more.
Our courts reopened on June 15th, 2020. This was in violation of Chief Judge Barbera's order, which stated that district courts should remain closed till July 20th. My first 7 dockets were full of all non-incarcerated clients. They had to come in for cases that ranged from driving without a license from 2015 to littering for throwing a single candy wrapper on the ground. They were forced to come into court, expose themselves to dozens of other people, just so that the state's attorney's office could dismiss these cases or ask for continuances because they couldn't get their own witnesses in court. This continues to happen in Montgomery County. We continue to have countless clients who aren't incarcerated, brought in for the most minor misdemeanors, exposed to COVID, exposing their families to COVID, exposing us to COVID, simply because the state is not willing to offer amnesty for all misdemeanors as they should be during these times.
One of our biggest concerns was the elevators in the courthouses. They had decided to use only the large courtrooms on the 5th floor of Courthouse East, the old post office building, which is now called the Cummings Courthouse. We contacted the judiciary and indicated that we felt unsafe riding the elevators, and could they please unlock the locked doors on the 2nd floor so that the staircase would be available to anyone who wanted to use it to get to the 5th floor, so they would not have to ride the elevator. We were told no. So subsequently, we suggested, well, hey, there's some really large courtrooms on the 2nd floor of the Cummings Courthouse, which are accessible by steps. Would you consider moving the large courtrooms that are going to be open to the 2nd floor so that people can take the steps if they're, in fact, uncomfortable riding on the elevator? We were told no. So then we suggested, well, hey, some of the biggest courtrooms in the entire Baltimore City Circuit Court are located in Courthouse West, which is the Mitchell Courthouse. So would you consider moving across the street so that we could all access these courtrooms by stairs? And we were told no. So we gave 3 reasonable alternatives to having to ride the elevators to the 5th floor of Courthouse East, and we were shot down on all 3.
We've been going back for a while now, but I don't think that the courts are ready. And I say that because when we come into court, we're supposed to have our temperature taken. They do that, but typically it's wrong. It says you're like 93, 92 degrees. And then they're supposed to ask you this questionnaire. They don't even ask you. They just take your temperature. They're like, okay, you're good. Go on. And then we go in to stand in the courtroom where the judge is surrounded by plexiglass. The wipes that we've been provided are alcohol-free, so I don't know what that does. So I bring my own Lysol to start killing all the germs.
One of the issues that we're worried about and that we've been dealing with reopening in my jurisdiction is around the mask mandate, how it's enforced, and when it gets enforced. And so what the chief judge has said is that the sheriffs in each of the jurisdictions are going to be in charge of enforcing the mask mandate. So that means that whoever comes in, has to wear a face covering, has to have their mouth or nose covered the entire time that they're there. The problem is I've seen, for example, bailiffs wrap an arm around a litigant, not someone who's being arrested, someone who's just in court because they have to be. I've seen bailiffs and sheriffs remove their face coverings in order to talk to one another or to talk to a judge. Themselves not follow the mask mandate, at least not to the point that it's supposed to be followed. And on top of everything else that we're already asking the sheriffs and the bailiffs to do, we're adding this other layer of enforcement to their jobs, which they have to come in and do every day. And the problem with that is, with asking those folks to enforce the mask mandate, is that, if they don't follow it themselves, or if there's a mistake or something else happens, who is going to correct that, or who is going to speak up or point that out, and who are they going to point it out to? Because we all want a safe courthouse. We want to be able to go to and from our jobs every day, come home to our families, and know that we're safe.
I have right now about 45 felony cases. Half of my clients are incarcerated, the other half are on the street. Most of my clients who are incarcerated are at Baltimore City Central Booking. That facility has seen 269 cases as of September 21st of the coronavirus. And the clients who are getting their court dates and getting their case disposed are the clients who are on the street. On a typical day in reception court, there are between 15, I've seen as many as 25 people in reception court waiting for their cases to be called. There is no option for a defense attorney to call for a jury trial. And so the offers are nowhere near what they would normally be when a client has the ability to ask for a jury trial on the spot. So what this leads to is people coming into court unnecessarily and getting their case postponed to a later date.
The pandemic hit the Prince George's County Jail fast. In April 2020, 9 out of every 10 people detained there who were tested for the virus tested positive. Without trials, the jail population has now risen to a point where nearly everyone detained there has to share a cell with another person. Everyone at the jail has been on lockdown for 23 hours per day for months. In the 1 hour they get out of their cells, it's impossible to socially distance. My clients are not safe, and they are eager to go to trial. And there is no excuse why their cases should not be prioritized for safe and speedy trials.
I've worked with both juvenile and adult populations during this pandemic. I have had young clients test positive for COVID. I have had many clients in both systems that have been denied release when we have documented medical issues that would put them at a much higher risk for COVID-19. In the past few weeks, I have also been in court for issues that could have been resolved virtually, in turn putting myself at risk, our clients at risk, the defense attorneys at risk, the state at risk, court staff at risk, you name it.
We've been doing so well with telework. And I think as long as we continue to keep the trips to the office at a minimum, we're going to be okay. My main concern is that reopening the jury trials is going hand in hand with increased demand to have court staff physically in the office. My DPD currently indicated that teleworking is ending as of October the 5th. This makes no sense. To endanger all of us, we're going to be in an enclosed space. There's no way to maintain social distancing. We're going to have visitors and clients, our attorneys, and court staff. It's not fair.
Now more than ever, we need safe, meaningful contact with our detained clients. The main way we currently have to talk to them is through time-limited phone calls that are useless for reviewing discovery. Now that we're reopening, phone calls just don't cut it. You have to see your client. This is what my visits have been like since I started going back to the jails. At MTC, I had to see my client in a common room where we were divided by a thick plexiglass barrier. We couldn't hear each other through it. We had to shout back and forth through the little holes drilled in the plexiglass in order to even hear each other. This is not ideal. At JCI, though I had requested a non-contact visit, they were not available when I arrived. But they are suboptimal anyway. They're not confidential and they're physically awkward, and it's hard to show video. So my client and I sat together in an airless room about 3 feet apart. His ratty face mask was so ill-fitting and restrictive I could barely hear him. By the way, JCI also has Skype for families, but not for lawyers. This is dangerous and unacceptable. We need safe, confidential, and effective access to our clients, by video and in person. Our clients need proper PPE. The courts, public safety, and our agency must make these things happen now.
I have to say, I love my office. I work with some really great people that I know I can count and depend on. But we do have a problem with this agency that started long before COVID, and that's a lack of communication. This agency has had a long-standing problem with communicating with its staff for as long as I've been here. A lot of times we have to find out information through hearsay, rumors, or even have to wait, to find out the information long after it's invalid. This now hits home for me as support staff who are frontline workers who have now been promised to have laptops so that we can telework safely, but also just so that we can work efficiently in the office as well. This promise was given at the beginning of the pandemic, right around the time when the courts were about to reopen for most of us in the courthouse and throughout the agency. They are relying us to get the job done. It's almost October now. The courts are about to open up across the entire state. For most of us, we still don't have any laptops at all. There has been little to no type of communication given to us about when we're going to get them, if we're going to get them. It costs $0 to communicate, yet this agency just doesn't do it. If they can't just do this one little thing effectively, especially now when it matters the most, when people's lives are at stake, how can I keep putting my faith and trust in them?
I want to thank everyone who shared those recent experiences. A lot of that sounded really familiar to me, and all of it was either frustrating or frightening or both. These issues aren't hypothetical ones either. I know that a bailiff in my district in Calvert County actually passed away from COVID last month. And just this week, a corrections officer at the Baltimore Central Intake Facility also died of COVID, the second CO at Central Intake to die this year. These are literally life and death choices that the judiciary and that our employers are making. And the people who are bearing the risk of those choices, all of us on this call, are not being consulted or even informed about those plans. And that's why we have to educate ourselves and find out what can be done to address our concerns and keep ourselves, our clients, and everyone else in the court system as safe as possible. So with that, let's meet our experts. Our first expert, Peter Dooley, is a certified industrial hygienist and safety professional with over 40 years of experience in the field of workplace health and safety. He's currently the lead consultant for the National Council on Occupational Safety and Health, and he's provided consulting services to OSHA, NIOSH, unions, and employers, and many other organizations and institutions over the course of his career. During the COVID-19 pandemic, Peter's provided guidance to many diverse workplaces in both the private and the public sector. Welcome, Peter.
Thank you.
Our second expert is Eunice Salcedo. Eunice is a health and safety specialist in AFSCME's Research and Collective Bargaining Department, where she advocates for worker rights and protections for AFSCME members. She started her career in the labor movement with the AFL-CIO and has continued to fight for workplace health and safety. She's earned a master's of public health with a concentration in environmental and occupational health. Welcome, Eunice.
Thanks, Henry.
So, Eunice and Peter, why don't we start? I want to ask you about how COVID-19 is spread. I know at the beginning of the pandemic, there was a lot of discussion about transmission through physical contact and sort of close speaking or coughing or other sort of contact of that nature. What's our current understanding of how COVID is likely to spread?
So the new evidence that has been increasing, as we have experienced the pandemic, is that COVID is largely transmitted through air, and that the transmission by infected individuals is through a variety of particles that are exhaled during speaking, shouting, sneezing, coughing. Any kind of exhalation can be putting these virus-laden particles in the air, and that really explains a lot of the way that it has spread so quickly and throughout the world. And it's complicated by the fact that many individuals who are infected don't know that they're infected. They're asymptomatic, right? And studies have shown like between 20 and 50% of the individuals testing positive are asymptomatic. So that's a huge unknown factor, and these individuals are not being detected by any kind of temperature testing or anything like that, and so that's a problem, and that is further complicated by the fact that the inadequacy of the availability and reliability of the testing that is being done, in the sense that it hasn't been done widely enough. And there's been a lot of problems with the turnaround time for people getting results. So the bottom line is you got to treat everyone as potentially infected, and that has changed the way that we need to be protecting everyone by assuming that there's possible airborne virus particles, sort of between individuals, between people.
So given that sort of updated understanding of airborne transmission, what should someone be worried about, or what kind of situations should someone avoid if they're trying to keep themselves safe and not infect other people?
Yeah, the fact of this airborne transmission has really helped kind of fine-tune the strategies for protection. And if we can go to the next slide. There's a concept that's known as the avoiding the 3 C's, just as a way to think about this in terms of how do we guard against the airborne nature of the virus, as well as we have to continue being vigilant, protecting against all possible routes of transmission, which includes possible contact with surfaces, with contaminated surfaces. Eyes can be an actual route of entry, but the main focus is for control is on the airborne nature of it. So the 3 C's, closed spaces with poor ventilation. So indoor, any activities going on indoor are greatly more hazardous than outdoors, right? Because you were just containing any virus-laden particles that are being exhaled by infected individuals. Crowded spaces, of course, again, this is a people-to-people infection virus. So the more people you have, the more potential for the hazardous exposures. So limiting numbers of people in spaces is really important. And the third one is avoiding close contact situations, such as close range conversation, any ways we can be putting less people in the space and having more protections, more space between people. The airborne nature, the 6-foot safety sort of guideline is not, sometimes cannot be adequate enough. And I think the policy is trying to use every tool that we have to protect people. There's no one silver sword out there. It's a combination of things. It's people wearing masks. It's people doing remote work where possible. Trying to avoid people, having to go into buildings, literally. There's all kinds of tools, as well as building ventilation changes that can be used to help. But ultimately, it's a matter of trying to really protect airspace between individuals.
So given that, if a workplace like, say, a courthouse is planning on reopening, what's the way to do that safely? What's the way to kind of stay away from these situations?
There's a lot that can be done. So you first want to start with a plan, right, before you go about and do anything. And in that plan, there should be a hazard assessment. And what a hazard assessment is it's a process of that we use to identify risks. And management and workers need to be involved in this. And it has to be workers very involved. And just as you saw in all of those videos, they were identifying all of these risks, right? And so we have to have workers involved in this. So first you want to identify the risks, the hazards. And the hazard is, this virus, but not just this virus. There's other types of hazards in the workplace, but we'll concentrate on the virus for this one. After you identify the hazard, you want to go ahead and start thinking about how to evaluate for the risk. And so what's the risk of being exposed to this virus when you're in the workplace? Once you've evaluated that risk, you want to go ahead and manage these control measures. The thing with this, though, is that every building is different. So every building does need a different hazard assessment because there's different characteristics about that building, right? Some buildings are newer and older, and that influences ventilation as well.
And it probably matters as well, not just between buildings, but places in the building, right? If I have a closed office versus somebody who works at like a front desk, that could change the risk and the control measures that are needed as well, right?
Exactly. And this is why it's so important to have a hazard assessment done for each specific building. And just to let you know a little bit about what Virginia has done. So Virginia has passed a temporary standard for COVID, and they're actually in the works of creating a permanent standard. So this is something that Virginia OSHA has done. And I just want to give you a quick glimpse of what a hazard assessment looks like, because it's important for workers to know what it looks like and what it entails. So if you give me 1 second so I can share that with you. So if you can see the screen, you can kind of see, there's that Virginia logo, but towards the bottom, it tells you step by step what should be in this hazard assessment. You see that first thing is you want to involve employees, workers, you want to review the data. This data could be the mechanical reports from ventilation. It could be the previous, if there's positive cases, an exposure log, looking at that log and why somebody was exposed. It can talk about, you can do a walkthrough, which is kind of an inspection of the workplace. And you want to assess the risk level. And lastly, you want to talk about control measures and how do we control for this. So after you've done this hazard assessment, you want to go ahead and start thinking about your plan. And so your plan has to have different things. It has to have your management commitment. It needs to have worker involvement. We've mentioned that. It needs to have, one second. It needs to have worker involvement, but also, communication. How are our members going to communicate? And how is management going to communicate to members? Management also needs to communicate with the local health department, right? So if somebody does get sick and tests positive for COVID-19, and maybe there's more than one, how is that communicated with the local health departments? So that's all very important information that needs to be included in this plan that's for reopening and making sure it's safe for workers.
So part of the plan has to be including the whole issue of workplace stress. As probably all of us have experienced, the pandemic has created a lot of stress in people's lives. And I think the testimonies on the video were just so great examples of people expressing the ways in which the lack of information has affected them, as well as knowing the experiences that can happen if the workplace is not prepared enough to put in these safe practices and a safe plan. And it's important to know that we can protect workers, and we can protect the public and community by taking very, very serious planning and implementation of control measures. This is all within the reality of figuring out how the workplace can function and still be safe. But it does take it takes resources, and it takes time and effort. But workers have a legal right to a safe and healthy workplace, and it's not only a legal right; it's a moral right for the employer to provide that kind of comfort and safety to every worker. So I think one of the ways that stress can be kind of dealt with is by workers sticking together. We've seen a lot of examples about how workers throughout this pandemic have banded together, demanded safer protections, and have in fact won protections not only for themselves and for the community. So I think it's really important that this forum is going on, and I really give a lot of credit to the fact that people are coming together and talking about what can be done to make sure that everyone is safe.
Let me ask kind of a follow-up question. Once you've started to identify these hazards and have sort of assessed them, what are the next steps? I think, Eunice, you mentioned some control measures. What do those actually look like?
Yeah. So once you assess the workplace, you have to think about how do we control for these hazards. And in this case, we're talking about the virus SARS-CoV-2, the virus that causes COVID-19, right? And so what we use is this hierarchy of controls that you see on the screen. The idea behind the hierarchy is that the top controls that you see in the top are more effective than the controls on the bottom, right? So the effectiveness goes down as you go down the upside down triangle, right? But the basic principle of workplace safety is that you want to use a collaboration of all of these controls, not just one, right? So you don't want just your employer giving you PPE, right? You want to control different controls, right? And so, for example, some office workers that work in the office, you can eliminate the hazard by having them telework at home, right? But that teleworking doesn't apply to everyone, right? So sometimes we might have to go down to engineering controls and administrative and PPE. Just to give an example, what an engineering control is, its example would be ventilation. And ventilation would address airborne transmission. Another example of an engineering control is plexiglass barriers, and that would be addressing that droplet transmission. So these are examples of engineering. An example of an administrative control is the policies that were put in place, right? So the mandatory face masks, the social distancing measures, limiting occupancy is also very important. That just minimizes the virus particles that are emitted in the air, so that's very crucial. And then lastly, you have PPE, your last line of defense. And so that's where you have respirators. That's, again, you want to use a combination of all of those.
So with that, I think we'll sort of transition now and start to talk a little bit about how this might look in the specific context of the court's reopening. So I'll say again to everyone listening on Zoom or on Facebook Live, ask your questions. We'll try to get to as many of them as we can. I want to start with one that I have. I know when you guys talk about the 3 C's, all 3 of those seem to apply to jury trials and specifically to asking jurors to go sit in a room together and talk with each other about the trial that they just saw. What can be done to make that kind of environment as safe as possible?
Certainly, the building ventilation needs a lot of assessment and implementation of modifications. And the whole concept is bringing in more outside air. Most building ventilation systems, have been operated with basically recirculated air. And as a efficiency for for the economics of it, the cost. But now with the virus, we need to get as much outside air into the spaces in the building. So that takes a lot of evaluation and modification, including improving the filtration systems in the ventilation systems, like the HVAC systems. That's one aspect that can be evaluated and improved to try to bring in better, cleaner air into the building. But that's only, again, it's, all of these strategies need to be complemented with all the other strategies that we have. Nothing is going to be the ultimate tool that's going to make it absolutely safe. It's all about sort of reducing people's risk and making it safer by doing everything possible and feasible to comply with the best recommendations that are out there. And related to ventilation, there is a lot of really very substantial recommendations by governmental agencies as well as professional groups that need to be implemented in buildings to try to make it safer. That's just one example.
Sort of on that point, other institutions that are sort of similar to the courts, like schools and businesses, have sort of gone through reopenings over the last couple months. Some of them have gone well, some of them have not gone so well. Yeah. What could the court system sort of learn from some of those reopenings about the best way to handle this?
So I can tell you a lot of the reopenings, have had serious problems. There's been a lot of proposed reopenings that have been delayed because of concerns from workers and other groups. Schools being an example. One example is in Chicago, where they had plans to be, opening up full steam with, in-person school starting in the beginning of September. And that was, that was changed, and that was delayed because the actual teachers union raised serious issues that the school system was not ready, and that is still going on in terms of being delayed, and that has happened in a lot of situations where the planned reopening had to be adjusted because of concerns that were raised by workers.
Another thing is that this virus transmits very quickly. It's contagious, more contagious than the seasonal flu. So, for example, if one person's infected, that one person can infect up to 2 to 3 susceptible individuals on average. So that just tells you how quickly it can spread if we start reopening without any controls, like blindly, right? So that's why it's so important and concerning just to see that it's not being done.
So someone is asking in the chat sort of a technical question. How could one go about assessing the ventilation in a given space? And sort of specifically, if the courts won't do it, is there a way for a union to assess ventilation sort of on their own, or even just for an interested person to try to evaluate the ventilation in a space? What does that process look like?
So there are ways to evaluate ventilation systems, but it takes it takes some real expertise in how ventilation systems work, how they can be modified, related to filtration systems, and again bringing in the outside air. Sometimes a really important resource is the folks in the building who are maintaining the HVAC systems, and that's the first people to be sort of getting good information about what the status of those systems are. But there's also a lot of, again, really good recommendations that are out there that we look at to use as guidance, and making sure that the employers are doing what's the best recommendations related to the COVID, and it's all changed, related to the pandemic. So it's fairly new territory in terms of making those modifications.
So a question that a couple folks are asking in the chat, and I know my colleague Kalia from the videos mentioned as well, that the lack of transparency in a lot of situations has been really frustrating. I mentioned that I heard about a court worker in the county next to mine who passed away from COVID, and I heard about that from other employees in the courts, and I don't think anyone in our agency was notified about that, and the lack of clear communication from the courts and from our employers has been a point of frustration for a lot of people. What does that do, not just sort of on the making us frustrated front, but does that impact sort of how safe the workplaces are as well?
There's a lot of things that can be done in terms of, sort of using any cases that there are, and that being an indicator that there needs to be an improved program put in place, new safety practices and such. And workers and unions do have certain rights to be basically doing workplace evaluations, getting information, making requests to employers related to what's being done to modify the building or put in safe, sort of programs to guard against the virus. So there are lots of avenues to be challenging sort of what might be done or not done related to protection for the virus.
I think also it's like, this is why it's so important to mobilize, get workers united. And it's not just about the numbers, but it's also about like having active members, talking about these concerns. So definitely, mobilizing and getting together. Mm-hmm.
Workers who have stood up and really, acted in collaboration and collectively with their coworkers, I mean, are the real heroes of this pandemic. I mean, they have gotten, you know, more protection for themselves, but this issue just, you know, the virus does not stop at the courthouse. These, you know, any infections are going to spill over to the community. It's going to spill over to the institutions. And so it has tremendous, and we're in the situation that we're in because preventive measures from the beginning were not put in place. You know, we could have handled this whole situation so much better, prevented so many deaths and illness and tragedies. And we gotta turn it around. And you know, we're still in the midst of an obvious, very, very problematic situation. Just, yeah.
We have time for about one more question, and it's one that a number of people have asked in the chat. Again, a lot of us have clients or friends or family members who are currently incarcerated in jails and in prisons. I know I have heard certain judges claim that those are actually safer places to be because they're trying to minimize entry and exit from those facilities. It seems to me, an amateur, that there's a lot of risks to that. What are some of the things that can be done? Is that accurate? Are those risky places? And what are some of the things that can be done to make that safer?
To talk about 2 points, and then Peter can probably add more. So there's overcrowding in these institutions. So that is, how do you social distance? It's very difficult. And also, you know, ventilation is probably a big issue as well. So just those two big issues, we see that there's huge outbreaks. I was just reading something in California. I believe a prison had a really huge outbreak, and you know, overcrowding is a very, very big issue as well.
All of the evidence, you know, proves that institutions are very, very, very hazardous, risky places. I mean, it's just the number of cases, the number of illnesses, the number of fatalities, all point to how dangerous those situations are, and that's expected. I mean, in the sense that we know that kind of situation, you know, is so risky because of the factors that Eunice mentioned. So they should be the first place, you know, that we're going to try to make safer. But obviously that has not happened enough. So it is a horrible situation in a lot of these institutions, unfortunately.
Well, I want to thank you both, Peter and Eunice, for taking the time to share your expertise with us. I want to thank everyone as well for asking questions in the chat. We weren't able to get to all of them. We will try to respond to some of them by email if we can, and if we can loop Eunice and Peter into answering a few more. But I want to just thank you both for sharing your knowledge with us. It doesn't exactly make me feel better about the courts reopening, but it makes me feel more knowledgeable and more equipped about what we can do and what we have to do. So thank you both.
Well, thank you for having us be involved, and good luck to everyone for you know, standing up for your right, for everyone's rights. Yeah.
Thanks. Well, thanks, Eunice. As Peter said, it's not enough for us just to know sort of what the courts can be doing better. We have to take that knowledge and turn it into action. The refusal of the judiciary, and for many of us, the refusal of our employers to involve workers in this health and safety process, means that their plans are not sufficient. And like Eunice and Peter said, all of us on this call are the ones who know our offices best and who know these courthouses inside and out, and yet we're not being consulted or even informed about what the plans are for reopening. And so the MDU, the Maryland Defenders Union, is taking action. First, we've asked multiple times for OPD management to sit down with us and to involve us in the process of developing safety plans for the offices and for the judiciary's reopening. And finally, Paul DeWolf agreed to meet with us tomorrow in what we hope is the first of many conversations about workplace health and safety, and an opportunity for us to take the fears and the worries of everyone on this call and of our members and of all OPD workers and to turn them into real action. The MDU is also putting pressure on the Maryland judiciary to fight for ourselves, our clients, and for every other person in the courthouses. We want the help of every person on this forum with that fight, and we'll be talking more about how you can pitch in just a few minutes. But we're also rallying support from other organizations in our communities and from legislators who know the importance of listening to workers and fighting for frontline employees. And with that, I'm thrilled to introduce our next speaker, Maryland State Delegate for District 39 in Montgomery County and a stalwart supporter of the union movement, Gabriel Acevero.
Hi everyone, State Delegate Gabriel Acevero here. I want to first thank all of the organizers of this evening's very important forum about the impact of COVID-19 on our state's judicial system. I also wanted to thank all of you, our public defenders, who every day do the important work of fighting for the indigent, fighting for low-income people, and fighting for the communities that haven't gotten a fair shake from our criminal legal system. I also wanted to express my support and solidarity with the Maryland Defenders Union, who wouldn't be the organization that it is without each and every one of you. You are the union. And whenever workers come together, whenever workers stand in solidarity and organize and collectively bargain, they are not just changing the conditions within their workplaces, they're changing the conditions in their communities. So I want to thank you for your leadership and your continued advocacy with respect to our criminal legal system. I also want to thank you for your advocacy on this issue and for putting forth these recommendations on how we can mitigate the impact of COVID-19 on our courthouses across the state. You're leading this discussion. And whenever workers come together, there is nothing that they cannot accomplish. So I want to applaud you, but I also wanted to say that as long as you are fighting that good fight, as long as you are getting into good trouble, as the late Congressman John Lewis so rightly put it, know that I will always stand with you, not as an ally, but as an accomplice, as a co-conspirator for justice. Thank you again for your engagement. Thank you again for your advocacy, and continue to fight for each other and continue to fight for the clients who need it the most. I'll see you at the nearest picket line.
Thanks to Delegate Acevero for those inspiring words and for joining us in our fight in health and safety in the time of COVID. He really is a strong supporter of the union movement and of public defenders specifically, and we couldn't be happier to have his support. But we want you to join us too. The MDU has drafted a letter to the judiciary calling on them to take action to make sure that these steps are followed so that the resumption of court functions are as safe as possible. We're going to read through that letter quickly now.
We, the staff, advocates, and justice stakeholders serving the people of Maryland, implore you to please act swiftly and promptly to remedy the rampant public health crisis occurring across the state's judicial system, one which will be further exacerbated by the October 5th, 2020 reopening. We serve the people of Maryland in seeking fair treatment, liberty, and access to justice for all. But we cannot do our jobs in a system that consistently places expedience and case closure rates above human health and safety. Courthouses across Maryland have remained open during the pandemic without proper sanitization, ventilation, and social distancing policies. Judges have failed to enforce, and at times themselves abide by, mask mandates. Some courthouses have flaunted the judiciary's phased-in reopening plan, resuming full in-person misdemeanor dockets as early as June of this year. Numerous people have become infected with COVID-19 and in some cases have even died as a result of this completely preventable spread. We are therefore skeptical at best that the Maryland judiciary's reopening plans announced on September 22nd, 2020 will do anything but provide cover for the disparate, inconsistent, and dangerous local interpretations of what a safe courthouse truly is. The judiciary also indicated in a committee hearing on September 22nd that there is a plan in place for every jurisdiction. Yet, these plans have not been made public and have not been distributed to the very people bearing the risk, staff, attorneys, and the people they serve. The judiciary also indicated that these plans were the product of a conference work group on the resumption of circuit courts. The members of this work group, however, were judges, clerks, jury commissioners, and court administrators, not community stakeholders with the firsthand experience needed for a comprehensive and safe reopening plan. We therefore call on the Maryland judiciary to act now to both end the spread of COVID-19 in courthouses across the state and to provide transparency on these critical public health issues by, number one, immediately ordering professional hazard assessments by independent public health experts in every courthouse across the state and ordering compliance therewith. Any courthouses that are not inspected or fail to comply with the recommendations of the hazard assessment should be immediately closed and returned to phase 1 activity until such compliance is achieved. A mechanism for public commentary involving agencies, organizations, and other community stakeholders must be created as courthouses reopen to foster accountability and so that members of the public can have input on courtroom policies and procedures during the COVID-19 pandemic. Number two, requiring a statewide scale back to phase 1 of reopening should statewide COVID-19 positivity rates exceed 5%, in line with WHO recommendations on reopening. These positivity rates should be determined by the number of individuals tested, not by the number of tests administered. Number three, exploring, in collaboration with all involved parties, ways of relieving the growing backlog of cases that do not punish litigants and defendants, such as amnesty for nonviolent offenses. Number four, prioritizing trials for those who are incarcerated, with an emphasis on ensuring that the constitutional right to a fair trial is protected during hearings, jury selection, and jury trials, even with COVID-19 restrictions in place. Number five, requiring each jurisdiction to devise and publicize a comprehensive COVID-19 safety plan in response to individual courthouse hazard assessments, including how to keep juries, courthouse staff, and litigants safe, as described in the enclosed fact sheet, COVID-19 Best Practices for Courthouses, prepared by the American Federation of State, County, and Municipal Employees. Number six, providing personal protective equipment for all litigants and HEPA air filtration systems in all high-risk exposure locations within courthouses. Number seven, ensuring that high-touch and common areas of all courthouses are cleaned and sanitized on a regular basis in accordance with any hazard assessment and COVID-19 safety plan. Upholding your mission to provide fair, efficient, and effective justice for all is a goal that we all share, but it cannot be achieved in the time of COVID-19 without effective leadership and action. We therefore ask that you please review these requests and take immediate action in advance of the October 5th, 2020 reopening date. The COVID-19 pandemic will, unfortunately, carry on for many months after October 5th. We cannot allow our clients, colleagues, and loved ones to continue to be needlessly exposed to this deadly virus in the interim. We look forward to your prompt attention to this matter. We are also available for a discussion about these issues and other challenges that this crisis has presented at your convenience.
As you can see, there are a number of signatories already on this letter, as well as the Maryland Defenders Union, the Maryland Justice Project, Local 3674 in the Maryland Judiciary, Local 3167 in DJS, Maryland Common Cause, Local 557 Perkins Hospital, Local 3478 Eastern Correctional Institute, the Maryland National Lawyers Guild, Local 1535 Baltimore State and City Workers, Local 1678 of the Jessup Correctional Institute, and the Maryland NAACP Statewide Conference. That's a wide range of signatories on this letter, not all of whom who the Maryland Defenders Union would always find itself agreeing with, but all of whom know that we are at risk if the courts don't open safely, and because we all know that the only way for that to happen is for the judiciary to listen to frontline workers. We want your support for this letter too. Go to this link, which people will be posting in the chat as well, and sign the letter. Add your name to it. If you represent an organization that wants to sign the letter, you can use the same link and let us know, and we'll add you as a signatory as well, your whole organization. We'll be sending this to Chief Judge Barbera tomorrow morning, and we want as many signatures on it as we can possibly get to send as powerful a message as we can. Next, if you're a worker at the Office of the Public Defender, we need you to join the Maryland Defenders Union. It's through the union that we can fight for our interests and our clients' interests, and we need you for that fight, both as it relates to COVID and as it relates to all of the other challenges that we and our clients face on a daily basis that started before this pandemic and won't end with this pandemic. We've grown to the point where we are now officially a local branch of AFSCME Maryland Council 3, Local 423, the Maryland Defenders Union. And we want you to join us. So sign your union card today at the link in the middle, or email the Maryland Defenders Union at gmail.com with any questions. I want to thank everyone for attending. I want to thank Eunice and Peter once again for sharing their expertise. Stay safe, everyone, and keep fighting.